Patient-centered care is a top priority. So why isn't it actually happening in our hospitals and clinics?
All right, so what's the real reason for this gap between policy and what actually happens day to day?
You see it endorsed everywhere in policy, but its real-world implementation is, well, pretty inconsistent.
And it's not because we lack clinical know-how or the right tech. The problem goes much deeper.
The real challenge is systemic. It's rooted in professional culture, medical education, and accountability. This means we have to rethink professionalism. It isn't just an individual thing, it's a system-level function. And while medical education is critical, what's learned informally often outweighs formal classroom teaching. This is the so-called hidden curriculum, where trainees learn values by observing what actually goes on.
So there's this huge disconnect, right? Formal lessons teach empathy, but students see task-oriented interactions.
And what people see every day is what really sticks, shaping their professional identity over time. This reframes things like communication and empathy. They aren't soft skills. They're critical for patient safety.
The thing is, structural issues in the healthcare environment can really erode this kind of professional behavior. We're talking about things like high workloads, staffing pressures, and really weak feedback mechanisms. This whole situation shifts the blame onto individual clinicians, leaving the larger system unexamined. So what's the solution? We need to move beyond just checking boxes and build a truly integrated system.
For any of this to last, it has to be built on organizational accountability and an integrated ecosystem. That means aligning accreditation standards, integrating medical education, and strengthening clinical governance.
This creates an environment where patient-centered care is actually seen, practiced, and becomes the norm.
So to wrap up, patient-centered care doesn't fail because of bad intentions or a lack of expertise.
It fails when professionalism is treated as an individual's problem, not a shared organizational responsibility.